think Minnesota has the best medical care system in the country. And I think we do. We have the highest quality and some of the lowest costs, but it's not sufficient. You know, just having the best medical care system isn't sufficient. We really do need to add that prevention piece a little bit more to the medical side, but we also need to do the community prevention stuff. And this is a good example of how we need to start doing that and institutionalizing it and making it part of our system. And so let me just end with this quotation from Confucius, whose birthday it is today. He said, "By 3 methods we may learn wisdom. First, by reflection, which is the noblest. Second, by imitation, which is the easiest. And third, by experience, which is the bitterest." Now, certainly I hope that you've had some time to reflect on what has been going on with all of these things in the back, all these posters. And I hope you can imitate some of these things that you've heard up here. And I hope you can now experience things in your community. And I hope it's not bitter. I hope it's bittersweet, knowing how hard it is to get some of these things done, but how sweet it is when they succeed, when we can really have the healthiest state possible, where we integrate medicine, social service, public health, education, transportation, housing, recreation, all of those things to make this a place where the quality of life is beyond measure. So thank you all. Good luck to all of you, and I now turn it over to Senator Durenberger. Good job.
Great. Angie did a great job in the Q&A, but Surgeon General leaned over to me halfway through the presentation and said, "If I am brief, do you think I can get questions from the audience?" And I said, "You betcha." So for those of you who are waiting to ask a question or make a comment, my job is to introduce the Surgeon General. But I'll start with, as long as Ehlinger is doing Confucius, I think he has a birthday 365 days out of the year. But here's something else he said that I was reminded of listening to these 5 people and what they have signed up to do in their lives. Choose a job you enjoy, and you'll never have to work another day in your life. Didn't you get that out of all 5 of them? And I'll bet a lot of you are doing that right now. I was impressed by 2 things. One, the panel, the poster people, and nobody needed a government grant to get any of this started. I thought that was impressive. But the second thing that is really impressive is that everything we've heard about in terms of health and wellness and prevention and all of these marvelous things, including the onion example, which I thought was so terrific, which could lead to frustration, but I guess it's just opportunity, right? Is it all brings out the we in us, rather than the me. The contrast between the so-called medical system, the reactive system, and so forth, and what you just heard here. And so even with the cardiologist, you're getting the we. Fantastic thing about community that illustrates. And to prove it, I remember the day that a lot of you know in health policy know State Senator Linda Berglund. And she started as a state senator specializing in health policy 5 days before I got elected to the United States Senate. And that was 18 years ago, because I'm in my 18th cohort, I think the 18th seminar. And I've got students here in the audience, and 2 of whom you're going to hear from. You've heard from one, Tina, and then you'll hear from Laura. But after Linda resigned and went to work for what is now called Healthy Hennepin, I said, "Hey, how'd you like to go to lunch?" And she said, "Oh, great." And I must tell you that there was a change. Linda Berglund. I could not believe the person I was having lunch with. And I said, "Why are you seem to be so happy, so excited, all this sort of thing?" And she said, over there I spend half my time saying no to people, having people say no to me, And this is all about yes, 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 yes. I think that's the onion theory, Jennifer, if I get that right. And she was having this, and I hope she still is, she's having this marvelous experience that almost all of you in the room have been enjoying. So the day that I met Dr. Regina Benjamin was probably one of those kinds of days. And about the second time we met, she called me on the telephone and she said, and this is an Alabama girl, she said, this is like in January, and she said, I accepted an opportunity to come to Minnesota. Would you mind meeting me there? And I didn't want to ask her why, because she probably looked at the thermometer or looked at the weather charts trying to predict what it was, and she wanted to make sure that somebody with a hat and a coat would meet, and earmuffs and whatnot else would meet her at the airport. But that was her first chance to come to Minnesota. And this is her second. The contrast between the two is substantial, because this was during the course of a life of a solo practice doc, primary care doctor, who spent 23 years of that life as a solo practitioner in Bayou Labatry, which is a small town running a federally qualified health clinic, a small town on the Gulf of Mexico, south of Mobile, which I used to think was on the Gulf already, but this is south of Mobile. When the hurricanes went through, out went the work of a lifetime. But it didn't actually go on, because she went right back to work again and rebuilt it. And again, it was community. And I won't go into the many other things that may have qualified Dr. Benjamin to be selected by President Obama to be the nation's Surgeon General. But for me, that says it all. That says it all. We couldn't have a better person serving us, all of us, as Surgeon General of the United States than Dr. Regina Benjamin. I have pleasure to introduce her to all of you.
Good evening. That was a great panel. And I have to say thank you, Dr. Ehlinger, for allowing me to be here as part of the Minnesota Public Health Association's annual meeting, and of course the Healthy Minnesota Communities in Action. But I also have to say, he gave my speech. So, he talked about everything I was going to talk about. I have the Surgeon General's Journey to Joy, which is about having fun and being healthy, and all the making it easier, and as well as the last things that you said. So you don't really have to listen to me if you want to nod off. And thank you, Senator Durenberger, and the University of St. Thomas M.B.A. Cohort 18 that I had the privilege of meeting back in March. And they've worked very hard on pulling this very impressive event together. How many of you are in the audience? Will you stand up? Great. Do we have any of last year's cohort? Because I met them last year as well. They're off working. And I also got to meet the United Health diverse scholars that were there. Any of you here? They're from all over the country, so they weren't just from Minnesota. But these are the leaders of your community, and they lead you well, and they will be doing a lot in your community, and so just wanted you to at least see who they were. The poster presentations and the community panel discussions was exactly what the National Prevention Strategy is trying to get moving across this country. You know, I'm a longtime champion of the power of prevention, and it's the foundation of my work as Surgeon General. Like you said, and several of the speakers said, health does not occur in a doctor's office, in the hospitals only. Health occurs where we live, where we learn, where we work, where we play, and where we pray. I believe that prevention offers the greatest opportunity to improve the health of America's families now and for decades to come. I also believe that prevention is the key to building a stronger and more sustainable healthcare system. And prevention is not new to the national dialogue. However, in recent years, it's become more vital and more relevant than ever before. It's an imperative. And this is largely due to the changing dynamics and demographics as more families struggle with chronic diseases such as hypertension and diabetes and obesity, and a tragic toll that they take, both personally and financially. The case for focusing more of the nation's attention and resources on prevention is more than a theory. It's a reality that's grounded in science and experience. We know that with better health, children attend school more regularly and are better able to learn. We know that with better health, adults are more productive and at work more days. And we know that with better health, seniors can better maintain their independence. On the other hand, we also know that the lack of prevention takes a devastating toll on patients, their families, their communities, and their workplace. Much of the illness and early death related to chronic diseases is caused by just 4 modifiable health risk behaviors: lack of physical activity, poor nutrition, tobacco use, and excessive alcohol consumption. So let me just tell you what you probably already know, how Minnesota ranks. In the recent years, Minnesota's made good progress in reducing smoking. In the last 10 years, smoking's decreased from 20% to 15%. You have a low rate of deaths from cardiovascular diseases compared to other states in the country. And Minnesota has one of the highest high school graduation rates in the nation, 86%. And we know that high school graduation is linked to health outcomes. But there's still work that needs to be done. 25% of adults in Minnesota and 23% of children are overweight or obese. Alcohol is a big problem. Minnesota ranks 44th in binge drinking. 18% of the population over age 18 reported drinking excessively in the last 30 days. However, Minnesota is still one of the healthiest states in the nation, with an overall health ranking of number 6 in the nation. You should be really proud of that. And that's due to the community working together, like we've seen here this afternoon, and with the panel and with the posters coming together. We have to make prevention part of our everyday lives and empower people to make better health choices. I'm pleased that the Obama administration has launched a broad agenda to help Americans get healthy, live longer, stay well, and thrive. As Surgeon General, I have the privilege of chairing the National Prevention Health Promotion Public Health Council that was established by the Affordable Care Act. The council consists of 17 cabinet-level heads of agencies, such as Department of Transportation, the Secretary of Agriculture, Secretary of Labor, Environmental Protection Agency, Department of Defense, HUD, all these cabinet-level heads sitting around a table for the first time ever talking about prevention and how we can work together. Last summer, the council released the first ever national prevention strategy. Our vision is to move our healthcare system from a focus on sickness and disease to a focus on wellness and prevention. Because if we truly want to reform healthcare in this country, we need to prevent people from getting sick in the first place. We need to stop the illness and stop the disease before it ever starts. So in addition to the state-of-the-art medicine, we need a new approach to promoting health and prevention in our communities, since staying healthy depends on other factors that influence our health, like housing and transportation, education, the availability of quality, affordable food, our workplaces, and our environment. Everything that these posters are showing you in the back. We want to change the way we think about health in this country, and that calls for the nation to take a more holistic and integrative approach to community health. Everything from safe highways and worksite wellness programs to clean air and healthy foods. And the goal of the National Prevention Strategy is to increase the number of Americans who are healthy at every stage of life. It's like one of my patients told me, she says, I want to get old, but I want to be upright. If we follow the recommendations of the National Prevention Strategy, we can prevent or at least significantly reduce the 5 leading causes of death. So we have been going around the country doing meetings just like this one to encourage people in the communities to implement the National Prevention Strategy. But today, I don't have to encourage you. Instead, I want to thank you for already implementing the National Prevention Strategy. I applaud the bipartisan Minnesota's vision for a better health state and its SHIP program, the State Health Improvement Plan, as well as the ones that you've heard here on the panel today. The same things that we've been promoting, they're already doing. This is a perfect example of how the National Prevention Strategy is supposed to work. I hope that other communities will look to you for inspiration and guidance on how to become healthy and fit. And like you, the federal government's working with partners in industry and corporations, education, philanthropy, local and state and tribal governments, all to bring the National Prevention Strategy to life. So I look forward to continuing to work with each of you in helping us become a more healthy and fit nation. And just to close, I know it's a lot of hard work. You get to a lot of obstacles. People don't understand why we need sidewalks, why are we wasting our time and our money, but you can see how important it is. And so I don't want you to get discouraged. I'd like for you to keep it up. And so I'm gonna end with a little story about a young girl who was jogging along the beach. As you know, I'm from the coast, so she was jogging along the beach early one morning. And as she was jogging, she saw this older gentleman tossing these starfish in the water one at a time. And she was running up and down the beach, and he was tossing these starfish. And when she finished her run, she just couldn't take it anymore. So she went up to him and she says, "Why are you bothering to toss those starfish in the water one at a time? There are hundreds and hundreds of starfish along the beach. As soon as the sun comes up, they're going to die off, and it's going to dry them off, and they're going to die anyway, and it's not going to make a difference. Why do you bother?" He looked at her, he reached down, picked up a starfish and said, "Because it makes a difference to this starfish." And he tossed it in the water. Don't ever forget that, you know, the work you're doing is important. Find your own starfish and continue to make a difference. Thank you.
You want to do the Q&A? Huh? Let's do some Q&A. Okay, we promised the opportunity to ask questions if you'd like, so anybody can step right up. If you got a Confucius story, step right up and tell the Confucius story.
No Confucius story ready for me, but I'm Janelle Waldock. I'm from Blue Cross and Blue Shield of Minnesota. The Prevention and Public Health Fund in the Affordable Care Act has provided the critical resources to do the kind of work that was demonstrated on the panel today, but it certainly has been a political target. Do you have advice for all of us in the room about what would be most helpful to the administration to continue to defend those resources?
Well, in the Affordable Care Act, as I said, the National Prevention Council was established. In addition, there was a prevention fund that's been established as well. It was initially $15 billion, and it's been whittled away, but it still has significant funding in it. During the Stimulus Act, we had the CPPW, the Communities Putting Prevention to Work grants. That was only for 2 years. In the Affordable Care Act, the Prevention Fund now funds the community transformation grants. And New Ulm just received that grant, and they're one of the few small communities around the country to receive that. And the idea is to make sure that the things we're doing have some sort of infrastructure, and that takes funding. And so we want to preserve those and try to give more, the more we can. Whatever you can do in your local communities to get your communities to understand the importance of it. I think people don't understand how important these community programs are, and it's up to us to talk them up and to show how they're making effects and they're affecting individuals. Let me mention my journey to joy while you're thinking. because the journey to joy is basically, I think that we need to find our own personal healthcare joy, what brings us joy. And we need to figure that out. And what brings you joy may be different from when it brings me joy in health. One person may want to run a marathon, that may be their thing. Another person may want to fit an old pair of jeans. And yet another person's healthcare joy is simply to sit up long enough to play with the grandkids in the afternoon. You find your own personal journey to joy, and our job is to help you get there, to make it easier, to make it affordable, and it shouldn't be hard to be healthy. And so that's our role in government and in public health, is to make it easier.
Jim Hart, retired physician, former M.P.A president. You talked about the 4 leading causes of disease, but I think we all know behind those are things like poverty and discrimination, inequity in education and income and so forth. How do you think about that next layer and how that works into all of this?
All those social determinants of health that we talk about all the time really do play a role. And that's why it's our job to make it easier, to take those into effect, to try to eliminate as many of those barriers as we can. I think we have to go out to where people are. In public health, we've often, in the Surgeon General's office, we'll write a report, we'll put out a report, and expect people to read it. They're not. So we've got to go where they are. We're using social media. We're trying to get to kids. This past, about a week ago, or 2 weeks ago now, we released the National Suicide Prevention Strategy. And one of the things we're doing with suicide prevention, as you know, 100 people a day are dying from suicide in this country. And so we're working with Facebook. And Facebook has put a place on all of their website that it's a bullet that you can just click on. And if you see one of your friends have comments that you think are at risk, send them to that bullet or link, and a person from a professional will contact them either by email or call. Someone from the National Prevention Suicide Lifeline will contact them. So we need to go where people are. Another place I've gotten a little criticism about, but it's working, is with hair. So I've teamed up with United Healthcare over the past 3 years to attend the Bonner Brother Hairstylist Show. The Bonner Brother Hair Show is the largest hair show in the world. 10,000 hairstylists attend that meeting. We, and actually United Healthcare basically sponsored the award, and we give an award for the most exercise-friendly hairstyle. And I think it's like $5,000 this year to the most exercise-friendly hairstyle. It's become very popular, and each year it's growing. And so this year, the hairstylists have now become ambassadors for public health in their well, not offices, but in their salons. It's clear that people will see their hairstylist more than they see their doctor. And so, so we can teach them things like, and we have taught them things like, we have a Million Hearts campaign. The Million Hearts campaign is simple, to try to prevent 1 million heart attacks in the next 5 years. So you do the ABCs, ABCS. Make sure you take an aspirin a day, make sure your blood pressure is under control, your cholesterol is under control, and the S is don't smoke. The hairdressers can talk about that when you're sitting in the chair or the barbershop chair. So we're getting them to be our ambassadors. We have to go where people are and not expect them to come to us anymore. And Twitter, we do a lot of Twitter chats, and that's been very successful. So.
I had a question. We're acknowledging that seniors or the elderly need to stay in their homes more so than being in nursing care or something that requires a lot more costs. And to the extent that we help facilitate that through the community, through families, and even educating the patients to help take care of themselves. And as you work in the different comprehensive view and partnerships with all the different state agencies, I'm thinking that there are some that are left out. For example, we know with housing, the elderly who have less money to pay for fix-ups of their homes have the most deterioration of their homes and don't have the funds to fix it through the government systems or any assistance. On top of that, I've seen where cities also create rules, because they're not legislative rules, where they will say if your house is not in tip-top shape, you don't have your exterior fixed or windows or everything just perfect, there's a $700 a day fine for each day that condition exists, plus jail time. So can you imagine what this does to a senior that's facing all these situations and needing all these different systems to work on a sensible solution to their problems? So how can you, at your level, bring things down to them to help them at their level and prevent heart attacks and mental health issues or everything else that can arise from things the systems create?
So we've been working with the Agency on Aging, which is within HHS, to look at a lot of that. One of the things I've been doing is working with the architects. There is something called the built communities, and all the research is showing that the built communities really work. When a house or subdivision, particularly a senior subdivision, when the houses have a front porch, the seniors do better. They stay in their homes longer simply by having a front porch, say in a cul-de-sac type. So these built communities make a big difference. Having people understand how important it is, you know, as some of us are getting to be elderly, and the generation, our generation is going to be taking over, I think we have to make more demands on making sure that we're treated equally. That as we age, we're not going to take it lying down. This generation has never did. They were the children of the 60s. They're now becoming older. They are used to fighting back, acting back, and we have to invigorate them to take their own control. And so things like that in the communities, they vote. They stand up in their community meetings and they talk about it. And so we have to make sure they're active and that they have that kind of information that will protect them. And so one of the things that Senator Durenberger didn't say, that when a question got too hard, I was going to turn it over to him. But that is a hard one.
I just stood up to say one more question. Joe, you got a last question.
Can you hear me? Thank you for the presentation. It was excellent. My name is Rick Branson. I'm a chiropractor with Fairview Health Systems. I've given presentations on the topic of health promotion, disease prevention, evidence-based health promotion, disease prevention. There's two things that kept coming up in these presentations in people that attended, and one is, what is a good definition of health promotion and disease prevention? And then what is a good definition of health? And if we don't have a universal accepted idea of what that is, it's hard as a community sometimes to move forward on that. And I was wondering if you could comment on that for me.
I think I mean, that's really a great comment. And I look to you if you've got some good definitions. We basically use the World Health Organization's definitions, but I'm sure there's better ones. So I'm open to hearing your suggestions about them, very much so.
You have one, Rick?
Okay. You know, I can't be a Surgeon General and not talk about smoking. So before I sit down, I want to say smoking. You've done well here in Minnesota, but every single day, 1,200 people die in America from cigarette smoking. Each one of those deaths are being replaced by 2 young smokers. We call them replacement smokers. 90% of all smokers start before the age of 18, 99% before the age of 26. And you know it's illegal now to market to 18 years and under, but it's not for that 18 to 26-year-olds. and over $1 million an hour is being marketed, directed to this age group. Actually, it's $27 million per day. This is our next generation, so if we can get them to just not take their first cigarette before the age of 26, there's less than 1% chance that they'll ever start. And so we could make our next generation tobacco-free. So we're starting a campaign on college campuses. These are our college kids, and if you start to look at it, they really are starting to take up the habit of cigarette smoking. So thank you very much for having me. Thank you. And thank you all.
I'll be brief. My name is Laura Templin-Hauk, and as Tina had mentioned, we came up with the idea of this forum after our visit to DC. The exhibitors and the panelists here have exceeded our expectations by leaps and bounds. I'm so impressed and so proud to be a part of Minnesota. I would like to thank our 40 initiatives that are in the back and all of our panelists for that stimulating conversation. Dave, thank you for your connections, of course. We couldn't get very far without that. And Dr. Benjamin, I want to thank you for visiting Minnesota. Your presence heightens the excitement for our forum. And finally, I want to thank Cindy Laura and Sandy Bauer. This event would not have happened without their support. We'd be nowhere. So I'd really like to give the two of them a round of applause because we'd be nowhere. So tomorrow morning, we'll be traveling down to the heart of New Ulm. They'll be hosting the Day of Play at Martin Luther College. So you're invited to come on down there. It's from, I believe, from 10 to 3, if I'm correct. Just Google Martin Luther College. That's where we'll be at. And now I'd like to invite you guys all back to the 40 initiatives. Check them out. And there'll be more food available for you now, which has been provided by our sponsors. So thank you for everybody for coming.